Today we're going to be talking about how 30% of us have metabolic syndrome and visceral fat suffocating our organs, leading to diabetes, heart disease, and stroke. If you want to learn how to prevent it, how to reverse it, and why it's happening, stay tuned. Hey, what's up everyone? My name is Labib Damouni, and we're going to talk about metabolic syndrome today. Metabolic syndrome is a cluster of 5 major risk factors that can lead to heart disease, diabetes, or stroke, or all 3 together. It's estimated that about 30% of the United States population has metabolic syndrome, and certain people think it's much more. So how do we develop metabolic syndrome? In order to understand that, we got to talk about 2 things: visceral fat and insulin resistance. Now, visceral fat is the fat that surrounds your organs. It's this stuff in there. And what that fat does is it causes insulin resistance to happen in the rest of your body. Now, the way it happens is a little complex, and we can get into it in a later video. But for now, just know that it causes insulin resistance. And I will link some articles in the description below for you to look at. Now, what is insulin resistance? Insulin resistance is when your cells in your muscles, fat, organs cannot take in sugar properly because they do not respond to insulin well. What does that mean? Basically, that means that the sugar in your blood stays there. It doesn't enter your cells when it's needed. So it ends up being turned into more fat, more visceral fat, which leads to more insulin resistance. And so you can see how this really messes up your metabolism, hence metabolic syndrome. Now, we'll touch a little more on visceral fat later on in this video. What are the markers that we need to look for? There are 5 of them. Okay, the first one we're going to talk about is high blood pressure. All right, everyone knows what blood pressure is. It's those 2 numbers, the systolic and the diastolic. The top one is systolic, the bottom one's diastolic. Top one is higher, the bottom one is lower. Normal is 120 over 80. Now, anything over 130 over 80 is considered high blood pressure and can be indicative of metabolic syndrome. It's very highly correlated as well with insulin resistance and obesity. So you're starting to see everything's connecting. Second thing that we're going to talk about is your blood glucose levels, or the amount of sugar in your blood. So the way you want to test this is by not eating for 12 hours, getting a blood test, and checking what your blood levels are of sugar. Anything over 100 milligrams per deciliter is high, and it's indicative of prediabetes and insulin resistance and even metabolic syndrome. Now, it's not that easy to get a blood test. You have to call your doctor, you have to, go see him, you have to get a blood test done. You got to not eat for 12 hours, you got to go get the blood test, then you get your results, and then you find out. So you can do that, but it's difficult. The next 2 factors are tied together. One of them is triglyceride levels, and the other is HDL levels. So, when you go to the doctor and you get a blood test and it tells you, they tell you, oh, your cholesterol is high. So they're looking at 3 values here. They're looking at your LDL, which is what everyone calls the bad cholesterol. We'll talk more about that later. I kind of disagree with that. Second is your HDL levels, which is your good cholesterol, and your triglyceride levels. Those 3 together make up your cholesterol number that the doctor tells you. Now, these 2 factors that indicate metabolic syndrome are high triglyceride levels and low HDL levels. So anything over 150 milligrams per deciliter of triglycerides in your blood is indicative of metabolic syndrome. On the other hand, if you have, as a man, 40 milligrams per deciliter or lower, and as a woman, 50 milligrams per deciliter or lower of HDL in your blood, that's also indicative of metabolic syndrome. And again, you have to make sure you do it fasting, you have to go to the doctor, you got to get a blood test. So it's not easy to obtain those results. Now, this one is the one that we can really utilize at home. It's really simple, and it's how big is your waistline? If it's 35 or more and you're a woman, that means you have a lot of visceral fat. If it's 40 or more and you're a man, that means you have a lot of visceral fat, which, as we've talked about before, visceral fat is what causes you to have insulin resistance, or one of the ways you get insulin resistance. It is the most strongly correlated factor with metabolic syndrome. So, now that we've talked about how we get it, why we get it, let's talk about how we prevent and reverse metabolic syndrome. So there's three main things you want to think about. There's stress management, exercise, and dietary change. Okay? So first of all, stress management. Everyone's going to be a little different on this one, and I will make a future video talking about stress and how we can manage it. But there are a couple of things, maybe three, that are extremely important for managing stress. Are you on a good sleep schedule? Are you exercising regularly? And are you breathing correctly? So when I say breathing correctly, I mean, are you breathing fully, or are you a chest breather? Do you breathe through your nose like you should, or are you breathing through your mouth? Are you taking full, deep breaths, or are they shallow? So we'll, again, make a video about this and talk about it in the future. Next, exercise. So even if it's something as simple as walking every evening with your significant other, or even by yourself or with your dog, just for 30 minutes, it's gonna go a long way to help you feel better and get healthy. That being said, I would like to tell you that improving the amount of muscle mass on your body, or increasing it, is extremely beneficial. It's been shown that as you get older, the more muscle mass you have, the less likely you are to die early, the less likely you are to get sick, the more likely you are to have a full life in your old age. So build muscle. Do it with weight training or calisthenics, but build muscle. Lastly, and most importantly, is your diet. Are you eating the proper foods? Now, we could do several long videos on diet, but what I'm going to talk about is two main things here. How we are going to reverse visceral fat, or get rid of it, and how are we going to stop increasing it. So to stop increasing the amount of visceral fat you have on your body, there is basically one main thing you want to avoid, and that is linoleic acid. Linoleic acid is a type of fat that is found in most seed and vegetable oils. So corn oil, soybean oil, olive oil, avocado oil, palm oil, canola oil, walnut oil, you name it. Pretty much any oil from a plant has linoleic acid in it. And it's been shown and you can check in the studies that I put in the description below, but it's been shown that linoleic acid increases visceral fat. And by increasing visceral fat, as well as the actions that linoleic acid has in your metabolism, it causes you to become more insulin resistant. And because you're insulin resistant, you put more fat on your body. So it's kind of like a positive feedback loop, and it just keeps getting worse and worse the more of it you eat. So don't eat that stuff. Okay, so now that we've covered how to avoid increasing visceral fat, let's talk about how to get rid of it. Now, this is gonna sound kind of counterintuitive, but the way you get rid of visceral fat is by eating fat. Now, it's not the fat that you think. It's not the seed or vegetable oils. It's animal fat. Mainly, the most important fat, which is going to sound weird, is it's grass-fed beef suet. Okay? And that's basically the fat around the kidneys. Second most valuable fat is beef tallow. So pretty much any fat on a cow. And lastly is butter, grass-fed butter. Now, the one thing that all these have in common is they are high in something called stearic acid, which is a long-chain fatty acid, and it's saturated. And stearic acid has been shown to decrease visceral fat in your body. So you should eat it. It's good for you. Eat your butter. If you've made it this far, I just want to say thanks for watching my video. Please like, comment, and subscribe. Let me know what you want to know. We'll talk about it in our next video. See you next time.